9 big cats at the Smithsonian's National Zoo tested presumptive positive for the virus that causes COVID-19 in September. Fortunately, they are now eating and behaving normally after receiving treatment for secondary bacterial infections.
There's not a treatment for COVID itself, so our veterinarians started treating with antibiotics. There were pain meds given and anti-nausea and appetite stimulant.
How the felines got infected is still unknown.
The most likely scenario is that an asymptomatic staff member would have passed this along. It's an airborne virus, and so things do get out around your masks.
Other species, such as primates, are testing positive for COVID-19 in zoos across the U.S. The Washington, D.C. and Baltimore zoos are among those gearing up to use an available experimental COVID vaccine to boost the immunity of their at-risk animals. Cheetah are one of the endangered species that will get vaccinated against COVID-19 before the end of the year at the Maryland Zoo. It should be a smooth process, since many of the animals at this facility are already trained by technicians to receive injections on a routine basis.
Something like a stick at first to just push a little bit on the animal for some pressure, and then they move to something like a needle with a cap on it, and then they'll move up to an actual injection. So there are multiple steps to get them to the point that they're voluntarily training for that procedure.
The pharmaceutical company Zoetis is donating over 11,000 doses of its COVID-19 vaccine to zoos nationwide. The company says the vaccine has proven to be safe in dogs, cats, and minks. But since it hasn't been tested in zoo animals, it's hard to say yet if they'll be protected, particularly against the Delta variant, and for how long.
Giving them 2 doses, you at least reduce the risk of exposure. The groups that receive the experimental vaccine have an obligation to report back to us and the USDA the disposition of those vaccines and what happened to those animals.
On October 7th, a snow leopard that had shown COVID-19 symptoms died at the Great Plains Zoo in South Dakota. A necropsy will determine the cause of death. Given the large number of visitors at zoos nationwide, questions have been raised over whether COVID-19 infections among the animals could pose a public health risk.
Probably not, because the population is small, so the infection will self-extinguish, meaning the animals will recover or they will die. At the end of the clinical trial, if there are infections in unvaccinated zoos and not in vaccinated zoos, we will have some evidence of the potency of the vaccine.
Staffers at the Maryland Zoo are hopeful the vaccine will indeed provide an extra layer of protection against COVID-19, especially for several species which are already listed as endangered.
Losing an animal in a zoo, there's always an impact. They're valuable to the breeding programs, they're valuable to the troop that they're in, the group that they're in, so obviously it would have a big impact on us.
Veronica Valderas Iglesias for VOA News at the Maryland Zoo in Baltimore.